So this is to discuss the shoulder complex movements. Remember that the shoulder complex includes both the scapulothoracic as well as the glenohumeral joint. We're also going to talk a little bit as we move into the glenohumeral joint movement, something called scapulohumeral rhythm. Actually, we're even going to talk about it before that when we get into upward or downward rotation. But basically that scapulohumeral rhythm means that in most movement patterns of the upper extremity, in other words, anytime you move your arm, pretty much the scapula is also going to move in some sort of coordinated, established pattern, which we'll get into as we move forward. So the first thing we'll talk about is the shoulder girdle. Remember that the shoulder girdle is made up of the scapula and the attachment of the scapula to the thorax by muscles, as well as the bony attachments that we can see with the sternoclavicular joint and the acromioclavicular joint. So elevation is simply just moving the scapula in that frontal plane, just going upward. So we'll start it in slow motion here, and what's neat is you can actually see the clavicle right here as it motions up and down. So that was elevation, and that's going to be depression going downward. So depression going downward, as we'll see, back into that relaxed position, which is not completely in a relaxed position. Basically, that's a postural position, which most people maintain when they're upright, versus I'm going to play it in slow motion here, but sort of, look at the point of the scapula, the acromion process here, and as it depresses just so slightly when she pushes her shoulders down. And we'll see it right about here, and she's going to push them down. So actually kind of forcefully or relaxing, and it just moves a very, very small degree. But we can see that relaxed position is actually going to be in normally when you're lying on your back, or you're going to have to force it down. This is just looking at it from a posterior view, so you can see that we have elevation and depression. The entire shoulder complex moves up and down. And then adduction and abduction, so that's going to be describing movement of the scapula within that frontal plane, meaning that it's not going to move forward, because moving forward is going to be protraction, and then moving backward is going to be retraction. So what we're looking at here is the side of the scapula, the medial border, and during abduction it's going to move in a lateral direction, and during adduction it's going to move in a medial direction. Adduction, abduction. So again, you can kind of see the outline of the scapula through the shirt here, and we'll just look at it in a little bit slower motion. So again, it's really maintaining in that frontal plane, versus what we're going to look at next is going to be protraction and retraction. Remember, the thorax is kind of barrel-shaped, so it does move anterior and posterior, and that's really going to be protraction and retraction. In most motions, however, when we look at protraction here, we'll see that shoulder complex is going to move completely forward, and then as it comes back, if you were to continue squeezing your shoulder blades together, then you would actually get adduction. So protraction here is just going to be movement in an anterior direction, versus the abduction that we saw that just took place in the frontal plane, and then retraction coming backwards here. So again, protraction, movement of the complex forward, and then retraction was going to be movement of the complex backwards. Now if we look at it from anterior view, and I like this view because you can actually see the clavicle as it sticks out, because as that shoulder complex moves forward, we've got some indentation here of the musculature in this anterior triangle that allows that clavicle to project more so to the anterior. And then the next motions that we'll be looking at are going to be the upward and downward rotation. So the upward and downward rotation, those are the ones that we're going to start to look at that scapulohumeral rhythm. So if you look at the inferior border of the angle right here of the scapula, we'll see that it actually moves upward and outward at the same time. And that's going to be a coordinated pattern that we see with abduction. So as she moves her arm up, right? So it'd be very difficult to see that without motion of the glenohumeral joint. And she's going to go up again and go into complete abduction. There we go. And then coming down is going to be adduction and downward rotation. So movement of those, that rotation is named for motion of the inferior angle of the scapula, hence the term upward rotation and downward rotation. So very difficult to be able to perform this without movement of the glenohumeral joint. Now you could in fact hold that scapula down, and we use this as an orthopedic test, and so if we go backwards here, right to about that point, okay, where she's approximately 90 degrees or so, right up to about that point, you could hold that scapula down, but that's as far as your arm would go, because then it would hit the acromion process, which is right here. So the head of the humerus wouldn't go any further. So that's why we have to have that scapulohumeral rhythm, because that's what allows us to get complete motion. So the glenohumeral joint, it's a ball and socket joint. So as we just saw, that we've got abduction and adduction, abduction, adduction. So it's just a different degree and range of motion. So we already saw that the scapulohumeral rhythm to that is going to be upward rotation and then downward rotation. And then flexion and extension is going to take place in that sagittal plane. So flexion, we'll see, is going to be movement of this anterior motion. So we'll start down here, and then it's going to finish up there. So that's going to be flexion, movement to the anterior. And then as we go backwards, that's going to be extension. And then we'll see here in a second, we're also going to get what's called hyperextension when she goes past the midline of her body. So that's going to be hyperextension. Again, just a continuation of extension, but we do see some motion here. And let me go backwards just for a quick second. So what we see, and you'll see it when she's moving her arm back down and forward, is we actually get a lift of that scapula. So we get a tilting of that scapula. So the inferior angle actually lifts up off of the thorax. So internal and external rotation. So we're going to look at it in the down position here. So external rotation is also referred to as lateral rotation. So movement going outwards. Internal rotation is movement going inwards, also referred to as medial rotation. And then what's going to happen when we look at her from the different position here, what we've done is we've abducted her arm. And one of the things I'd like you to take note of is look at her initial starting position and sort of consider, where the musculature is and how that can affect the overall motion. So we get external rotation, and then we get internal rotation, external rotation, internal rotation. So they're always described for the actual motions. And then the last one is called circumduction, which is really just a coordinated movement pattern that we see with all of these. And that's the benefit of having that ball and socket joint, is we can get all of those motions together.